Thank you for this introduction. I would like to first thank the organizer to give me the opportunity to have this talk on social media and how could we reach more equity in healthcare and research using social media in Africa. But why use social media? The short answer is because that's where your audience are. Introduced in the mid 2000s, social media has indeed exploded in popularity. In the world of public health, social media is now considered an important way to reach target audiences, either to deliver health promotion messages directly to those we serve or to drive viewers to websites and other resources for more information. Social media can be an important tool to reach individuals with low socioeconomic status characteristic with health resources and tips. Many people have smartphones even if they don't have computers, and most especially younger people are on social media. So how could social media improve equity in healthcare? Actually, access to care for children with rheumatic diseases is often limited, and there is a significant need for improved access to information, education, and support for both patients and healthcare providers. Social media can help bridge this gap by providing a platform for education, communication, and collaboration, and can ultimately help to improve outcomes for children with rheumatic diseases. Social media can also be used to connect patients with healthcare providers, particularly in areas where there are few specialists available. Indeed, telehealth can reduce inequities by providing easier access to care for patients living in rural or remote areas and by promoting continuity of care with cost-effective advantages in facilitating access to and use of health services and health education. But first, achieving health equity in telehealth will require mobilizing the resources of financial incentive and political will among hospital systems, insurance companies, and governments. Second, integrating the use of digital health into population health approaches will necessitate the acceptance that people come first and technology comes second. So to achieve this, we need the commitment of various key partners, scientific community, local leaders and patients, by adapting to the language, culture, administrative circuits, and familiarity of communities with digital services. We can also learn from foreign experiences and adapt them to our context to optimize collective efforts. What about pediatric rheumatology? In Africa, one of the key challenges in pediatric rheumatology, as you know, is the limited number of trained specialists. There are few rheumatologist training programs in Africa, and many countries do not have a dedicated pediatric rheumatology department. This can lead to delays in diagnosis and treatments and the lack of access to appropriate care for many children with rheumatic disease. Social media platforms such as WhatsApp and Facebook connect healthcare professionals across the continent, could share knowledge and best practices and support the development of pediatric rheumatology services in countries where they are currently unavailable. Another challenge in pediatric rheumatology in Africa is the lack of awareness and understanding of rheumatic disease among patients and their families. Many rheumatic diseases can present with no specific symptoms, which can lead, as you know, to delays in diagnosis and treatment. Additionally, there may be cultural and linguistic barriers that can limit access to care and understanding of the disease. So here, social media can help address this challenge by providing access to information and research about pediatric rheumatic diseases in languages and formats that are accessible to patients and their families. Finally, social media can also play a role in promoting research in pediatric rheumatology in Africa. There is a significant need for more research in this area, particularly in understanding the epidemiology and natural history of rheumatic disease in our context. So, let's move to social media and research. When most people think of social media, and most doctors and practitioners, they think of selfies, vacation photos, and photo of food. So it's no surprise that researchers are not fully involved in using social media to promote their research. However, this could be the wrong way to look at social media. And if researchers use these platforms to their full potential, their feelings towards social media and academic work may change. To give you an example, if I ask you what's your outstanding memory of 2022, most of you, I hope, agree with me if I choose the Qatar 2022 World Cup and the historical performance of the Moroccan team. On the other side, the past year we celebrated the African women rheumatologists workforce, and we published 2 papers on the Lancet Rheumatology. These publications were mostly driven by social media. So let me show you how this all began. First, we will begin by the e-collaboration and how social media allow you to make international and regional collaboration. Last year, in January, on Twitter, a call of submission in the special issue of Lancet Rheumatology about gender and equity in rheumatology under the banner of diversity, equity, and inclusion was posted. And knowing that there are few local studies and a great interest in being as representative as possible by the editors, we proposed to some colleagues to participate in this upcoming issue. I received positive feedback from Professor Turaya Raisi, who I followed on LinkedIn and Twitter but never contacted before, and positive feedback from the PAFLAR team with Dr. Farhana Parouk, who I collaborate with for a previous study, and Madame la Présidente, Zifa, who I only knew throughout WhatsApp organizational group of PAFLAR. Six months and several meetings later, thanks to the enthusiasm and involvement of all the teams, we were able to submit the articles on time. The idea was to propose an innovative, feasible topic for the special issue, to be more visible as an African rheumatologic researcher. So here, social media platforms can be used to create professional forums to share knowledge, combat isolation, facilitate and expand networking and collaboration, support professional development, and provide mentoring. Also, it's eliminating geographical barriers while bringing people closer together. Now we will see how social media could help to build networks, and the best example within the rheumatologic community is the GRA, the Global Rheumatological Alliance. In fact, from one tweet, The social media engagement was instrumental in the formation of the COVID-19 Global Rheumatology Alliance. One tweet from one rheumatologist precipitated the development of an international grassroots organization with the goal of exploring the impact of the COVID-19 pandemic on the rheumatology patients community. Since its inception in March 2020, the GRA has grown to over 400 members, 300 sponsoring organizations, and over 10,000 mailing list subscribers. Physicians have contributed thousands of cases to a physician report registry, and patients have contributed their own data to a patient report to the registry. In a few short months, the GRA has grown from a tweet to an organization which has produced 50 articles in peer-reviewed journals, as well as multiple messages through social media platforms that enable patients and providers to get very early information about the outcomes of COVID-19 in people with immune-mediated diseases. So using platforms like Twitter, Instagram, or Facebook, it's easy and instantly possible to get in touch with people from all over the world and different disciplines to network, discuss topics and issues, or to initiate collaborative projects. What about patient involvement? Patient engagement, as you know, is an important component of research, particularly in diseases like pediatric rheumatology disorder, where patient perspective can provide valuable insight. So online surveys are currently one of the most. So we conduct a study that aims to identify the most effective recruitment strategies for online researcher study and to determine the optimal survey channels for obtaining patient responses. Multiple recruitment strategies were disseminated in Arabic, English, and French. Channels used by patients to complete the survey were divided into three categories: social media, doctor, and patients association. A total of 1,595 patients from 19 Arab countries completed the survey. Patients' mean age was 39 years. The majority were female. 70% had a university education level, and more than 90% answered the survey in Arabic. The channels used to complete the survey were first social media, which include Facebook, Instagram, Twitter, Snapchat, Messenger, and WhatsApp groups, followed by the doctor, one-to-one contact, and patient association. And this was correlated with age and GDP. So, to optimize recruitments, and it's recommended to combine multiple strategy and channels, use the native language and be active by mobilize teams, reactive by provide prompt technical support, and proactive to share regular updates and reminders. But what's the view of social media by rheumatologists? I will develop here a study conducted in 2033 European rheumatologists with the aim to explore patterns in the use of social media within rheumatology. And this study showed that 70% were using social media professionally for communicating with friends and colleagues, receiving news and clinical updates and research updates. Only a few people expressed concern regarding a possible negative impact on their reputation when using social media, highlighting that this may not be a major barrier to use it. But lack of knowledge on how to use social media was the most commonly reported reason for no use in it, highlighting the need to better understand the value of social media and an opportunity to educate potential users on how to positively use it to facilitate learning and interprofessional relationship. So my take-home message here is that education on the safe use of social media, setting adequate privacy settings, and the relevant guidelines on the ethical use of social media can help limit its disadvantage. So, for your first social media researcher content, it's not already done. Please start with finding the right channel for your research promotion need. It could be Twitter, for example, or LinkedIn. On Twitter, it's a great resource to learn about important research papers even before they are released. And you could use Twitter also to follow science conferences like PAFLAR, receive information nearly as effectively as actually attending the presentation, support the potential for presenters to reach a wider audience, possibly attract funding interests also. And publishing an article in a journal now will only give you 50% chance of getting cited. Promotion and distribution of the articles and journals will need to be the other 50%, and we need to learn more about this communication, scientific communication about our research. So to conclude, I think that I convinced you that we could together reach more equity in healthcare and research using social media in the field of pediatric rheumatology in Africa. And for this, as the African rheumatology community, we should embrace the principle that social media holds immense potential to meet, connect, and co-create together. We are all in this together, and social media makes it easier to collaborate and reach our goals. Merci beaucoup. Thank you for your attention.